my thought is that as I tick through some of these common themes that I see, some of them probably won't be particularly applicable to you, but many of the, hopefully it'll be instructive, and you're probably wrestling with a lot of these same issues yourself in your own companies. Some employers have been calling to follow up on some comments that were already made with regard to the applicable large employer definition and this 50 full-time equivalent threshold for purposes of who has to offer coverage or else face penalties. The controlled group rules are really coming into play. So in other words, companies that historically have thought of themselves as small employers are absolutely calling me and saying, okay, under Code Section 414, who do I have to count? This one owner has some other level of ownership in this completely unrelated business. Do I now have to worry about what they're doing and count them? So there's a lot of controlled group analysis going on. I'm also getting a lot of questions about how to count part-time folks for purposes of reaching that threshold number. And as you're probably aware, you do need to utilize equivalency methods to include the sort of, a portion of the 2 part-time people equals 1 full-time person is this sort of easy way to understand that you do need to utilize that method to count your employee base, although, of course, you don't then need to offer your part-time folks coverage. So there's some sort of logistical questions. Then I'm getting a whole host of administrative and participant communication-related questions. So some of the decisions that are being made relate to, you've probably heard over the last 3 years, this concept of grandfathered health plans. And that was in the original legislation. President Obama and others who championed this legislation had said, great news, if you as an employer already offer a plan on March 23rd, 2010, when this was passed, so long as you don't make too many changes or tweak too many things in that coverage, you can keep doing exactly what you're doing and you shouldn't feel any pressure to make changes. I do have some clients who have continued to try to maintain grandfathered status over these ensuing years. It's becoming more and more difficult because from a cost and pricing perspective, it's extremely difficult to limit the amount of increases that they're trying to pass on or they need to pass on to their employees. As a practical matter, my sort of observation would be the only clients that I have who are fighting tooth and nail to maintain grandfathered status are the discriminatory fully insured plans, because self-funded group health plans have always been subject to non-discrimination testing. And of course, when we talk about non-discrimination in this context, we're talking about income-based discrimination. So in other words, self-insured plans, you could never offer cheaper benefits or richer benefits to your top dogs as opposed to your rank and file. Well, now, it's not enforced yet because we're still waiting for regulations, but ultimately, even fully insured plans that didn't used to have to worry about this are going to have to sort of play by similar rules unless you're a grandfathered plan. And so sometimes if you see these management carve-out programs or something that clearly on its face it is discriminatory because it's only the top brass that is even able to enter into this plan, those are the types of employers that I'm seeing maintain grandfathered status and seeking my advice on the amount of disclosure to go through and sort of the business judgment. I'm also on the affordability prong, and I would think for retail this is going to impact you greatly. I am getting a lot of questions about how, as a practical matter, to plan for trying to make sure that you're not exceeding, the premiums that you're trying to pass on to your employees don't exceed 9.5% of their compensation. It's one of those things that when you just sort of read it as a sentence, it sounds intuitive and simple to administer. It is anything but, because you are trying to make business decisions before you know what someone's compensation is going to be. And of course, as you're probably aware, the 9.5% threshold is actually on household compensation. Well, you have no idea what household compensation is. You don't know if there's a spouse who works outside the home who could supplement your employees' household income. And so the government has given us a series of regulations that allow for certain safe harbors. So we can sort of do the best we can to try to set premium levels at stages that won't be too expensive. Now, on this note, just sort of one aside, as an ERISA lawyer, as a benefits lawyer, I try to pride myself on always advising clients to follow the law and to do what they're supposed to do. This is an example of an instance where I try to make sure that I think as a businesswoman and try to think as you all would think as you plan for rolling out your plans next year. In other words, if it is going to cost you tens of thousands of dollars in excess premiums, if you're going to eat that premium cost so as to keep the premium low for your employees, you better spend some time looking at the number of people who could possibly fall afoul of this affordability prong. So in other words, the only time you're going to actually be charged a penalty for having failed to offer affordable coverage is if that full-time employee says no thank you to your coverage, goes out to the exchange, gets the exchange coverage, does not qualify for Medicaid, and whose household income qualifies him or her for the subsidy, which is 100% to 400% of the federal poverty rate. Those are a lot of things that have to happen, I would say. If you actually look at the projections, I think you could probably hone in on a much smaller number of employees that you could potentially face penalties for. So I would just invite you, again, I'm not saying, please don't understand me to say, don't worry about offering affordable coverage, do whatever you want, jack up the prices. I think, though, you do need to be prudent and look at your risks when you're making this business decision. So that's just my soapbox. I'm helping a lot of employees with the administrative tasks related to tracking employee hours. Honestly, it's not inherently difficult to conceptualize what you're going to do for those folks who clearly work over 30 hours or who clearly are always going to work 29 or less hours. But as you know, you have a lot of employees who probably don't fall clearly within one of those two buckets. And so really, those folks are the ones that are demanding so much of your time and efforts now from a planning and a tracking perspective. Those are under this legislation referred to as variable hour employees. So maybe, as Arnie said, it depends on your peak season. You're going to ramp up hours, but then they're going to come way back down. And to grossly simplify the regulations in this area, you basically are allowed for those folks to sort of take a period of time, measure their actual working habits, their actual hours, administratively prepare to offer them some coverage, and then there will be a subsequent period during which they call this the stability period. Those folks, based on the hours they worked in the measurement period, will be sort of locked in to either being eligible or not eligible for the entirety of the stability period. And if you stop and think about that, it can be challenging and a little frustrating, because if somebody has really sort of peaked during the measurement period and they're only working 5 hours a week during the stability period, doesn't matter that you need to have them offered coverage under your plan. In terms of participant reporting, I'm getting a lot of questions related to supplementing the summary of benefits and coverage. That for calendar year plans, this wouldn't be Arnie's plan as an 8-1 start, but for those of you with calendar year plans, you would have passed these out for the first time last fall as part of your open enrollment. And quite frankly, most companies would take what the insurance company or what the third-party administrator handed them and pass it to their employees. And quite frankly, that's not always an appropriate course of action. Oftentimes, I saw SBCs that were extremely poorly written, were factually inaccurate, were misleading. And so I think that it's prudent to run those by your trusted advisors to make sure that they are an accurate representation of your plan. Similarly, it's already been mentioned that by October 1, you all will be passing out exchange notices identifying the fact or alerting employees to the fact that they can go to the exchange as individuals. And many of my clients are preparing to supplement that notice with a memo on the front that tries to make things a little clearer and calm the sense of panic, because otherwise every HR department in the state is going to have an influx of people just panicked when they get these notices, because of course we know no one's going to actually read them. For those of you who offer health flexible spending accounts, you'll be aware that there's a lot of action there with limiting the amount of salary defaults that you can make on an annual basis. It's in place already, $2,500 a year, but in terms of documenting that change within your Code Section 125 cafeteria plan, that legally has to happen by the end of the next calendar year, so I'm doing some drafting work on that. For my self-funded clients, we're doing a lot of fee calculations and assistance with remitting those fees. The PCOR fees, the patient-centered outcome research fees for calendar year plans are due for the first time July 31 on the IRS Form 720. And again, there's multiple ways that you can compute the dollar per belly button in your plan fee. It sounds easy, but there's, dozens and dozens of pages of regulations explaining how you go about doing that. And then finally, I think that, as has already been mentioned, much of my time is being focused on some of just the helping from a business perspective with the ultimate pay or play decision, and to really look at the end of this all, once we have gathered all this good information and we sit down and try to make a decision now, as you say, this summer is the time that everyone's going to have to make this difficult decision. What are the employee morale issues? What are the recruiting, retention issues to consider? Are we going to have to increase salary to offset cutting back on our benefits? Those sorts of things. So that's, in a nutshell, how I'm spending much of my time. It's a great time to be a benefits lawyer. I bet.